outbreak in Victoria. So we reported from yesterday, so we reported this morning 24 locally acquired cases of COVID-19. Of these, 20 cases are linked to known outbreaks, and 18 of the 24 have been in isolation for the entirety of their infectious period. Jerome will run through the details shortly. Of the current outbreak, we currently have 12 people in hospital, and we have 2 people in ICU, and we extend our sympathy and support to those people. Neither are ventilated, but we also thank our hard-working frontline healthcare workers for the great work they do in supporting people in hospital. Of the 246 active cases that we currently have in Victoria, 56 are aged under the age of 9 years old, and 55 are aged between 10 and 19. Yesterday, we administered 27,123 vaccines in our state-run clinics, and an even higher number through our GPs and primary healthcare providers, and that was pleasing to see. In our state-run clinics, we've now passed more than 2 million doses administered by our teams in those locations. I want to thank all those Victorians for coming forward and getting tested. And we've seen over 4 million right across the state from all platforms of delivery. Yesterday, we also saw 39,832 COVID tests, and I'm very pleased to see that those numbers are increasing, but there's more to be done in that area, and I'll touch on that very shortly. And I'm also pleased to see that we've expanded the testing capacity, particularly in the City of Port Phillip and City of Glen Eira areas, especially in the St Kilda East, Caulfield areas of those two, or one location really. Today, a drive-through and walk-up testing centre has been established at the St Kilda Palais car park. It opened this morning, it's open now, and it will continue operating for as long as it needs to into the future. It's open from 9 a.m. to 5 p.m. From here on in. It's both a drive-in and a walk-in centre for people in that community. But it's just one option in that space of the inner south. There's the Brighton Golf Club, there's the facility at the Albert Park Reserve next to, in behind the pit buildings, there's the Alfred Hospital, there's the Paran Town Hall, there's Golfers Drive in East Malvern, and there's others. So I'd encourage anyone in that part of town just to hop online and look at where your nearest testing options are, and keep an eye on the demand levels that can allow you, for instance, as I know from direct experience, sometimes in that community it's quicker to go to the showgrounds. I can assure you from direct experience that that's been the case. And the showgrounds is a very large site, very efficient, and not to be ruled out as an option. It might well save you long time waits. And of course, travelling for vaccinations is one of the approved reasons for leaving your 5-kilometre restricted areas. So please visit coronavirus.vic.gov.au to see all the wait live times and make an appropriate decision. There is nothing more important in this current climate than making sure our contact tracers and our public health teams stay ahead of the virus, and that comes from better testing numbers. And particularly in the areas where we've got a strong focus, we want to make sure that our testing numbers are up. Not just in those areas. If you show any signs of COVID-19 with such low levels of general flu symptoms and cold symptoms, if you show any symptoms, work on the basis that it's COVID, come forward and please get tested. I just want to particularly refer to the St Kilda, East St Kilda, Caulfield community. that's facing some challenges at the moment, and we'll go through those challenges. We've been monitoring those growing numbers in recent days, whether, as we indicated yesterday, whether it's not linked by occupation, it's not linked by footy clubs, not linked by faith, it's linked by geography. And it's a rich and a diverse community, and one that I know pretty well. And it's a community that has always had a really strong community ethos of standing up when it counts, and now is one of those times. And we know that every case is different, and that every case can be complex, and many cases can be linked in sensitive settings, and we have systems in place to take account of each of those particular settings. I can confirm that the reports that one of the positive cases in recent days is a sex worker, and I can also confirm that that person is safely quarantining and is under the best possible care. So we need to deal with that issue, as we deal with all issues, respectfully and carefully. We're working with that individual, and their privacy is assured. I stress there is no evidence of transmission having occurred because of this person's sex work occupation, but out of caution, we are asking that if you have employed a sex worker in the St Kilda area, you need to come forward and get tested. And no matter where you are, you need to come forward and get tested. We are working with our partners, particularly in the local community health sector, who are doing an outstanding job on the ground in working with some of the vulnerable community members in that setting, particularly through the place where the person lives and other arrangements in that pretty diverse St Kilda community. Just like we're working through with the faith communities in that part of town and other parts of that community. This is an outbreak that is defined by geography and stretches from one end, Middle Park, all the way through to Caulfield North. And what we have to do is run it down by high levels of testing and at the same time, deep engagement with each of the communities in that part of town. I can add that we've already tested a number of the close primary contacts of this person, and I'm pleased to report that all of those tests that have so far come back in are negative. But to be clear, this is an outbreak not of a particular part of that rich, diverse community. It's an outbreak that has reached across the different geographic parts of, essentially from Middle Park at one end to Caulfield North at the other. And we want to make sure that issues of what faith you follow, what profession you're involved with, what your arrangements are, in what your form of housing is, that the issue here is that this virus does not discriminate on the basis of those factors. It targets out anyone it can get its grips into, and what I'm calling for in this community is for people to come forward and get tested. It's the most important thing you can do to help our community stay ahead of this outbreak. More broadly, on testing, testing is important no matter where you are in Victoria, no matter what your background is, no matter what your community that you're a part of. So that's why today we're launching a new advertising campaign encouraging Victorians to see that if their possible cold symptoms might not just be a cold symptoms, it might be COVID-19 symptoms. In fact, given the low levels of other forms of illness in the community, there's every chance it is. So you need to come forward and get tested no matter what those symptoms are. So what we want to do is drive up testing numbers right across the state. The new campaign, Only a Test Can Tell, will launch across all media platforms in the coming days, including on television and radio networks today. It will run for as long as it's needed, and I'm sure it will help build up the numbers of Victorians who come forward and get tested. We say time and time again, because it's true, if you have even the most slight of symptoms, or if you've been to an exposure site, or you're a contact in a primary or secondary, you need to come forward and get tested. It's the most important thing you can do. But if you just think you've got a cold, it might well be the inadvertent spreading of COVID-19. And given the weather in Melbourne during winter, we know that people might well need to be tested on multiple occasions as we get through this winter and autumn period. Only a test can tell if your runny nose is really a COVID-19 runny nose. If you've got a cough, only a test can tell if that is a COVID-19 cough. And if you've got a fever, only a COVID-19 test will tell you if that is a COVID-19 fever. The earliest you get tested, the earliest that you get a response back is the way in which you can help us all stay ahead of this outbreak. An early positive test, should you get it, means that you can take action to protect yourself and protect your family and protect your community. If you get a negative test, that's even better. That gives you and your family the reassurance that you need to then take the next steps in your community. The negative test is that ultimate reassurance. I might ask Jerome now to take us through the 24 cases and a couple of other matters, and then we're happy to take questions.
Thank you, Minister, and good morning. 24 new positive cases today in Victoria, all community cases. That gives us 246 active cases of COVID currently in this outbreak. There are 12 people currently in hospital. 2 of those are in ICU, and of course we send our very best wishes to all of them for their effective and swift recovery. We have around 15,000 primary close contacts that we're following through at the moment, and I'll come back to that in a moment. Of the new cases today, of the 24, 18 were in isolation for their full infectious period. 6 were not, and I'll give some details on those. Of the cases today, 10 are associated with students and household members of Altaqua College, and we've seen this pattern now over the last few days of the virus continuing to be very aggressive in those households. 3 students and 7 household members. There are 4 household members associated with Glenroy West Primary School in that Glenroy West cluster. That gives us 14. There are 2 contacts associated with retail facilities in Caroline Springs Square Shopping Centre. That gives us 16. 1 household member associated with Newport Footy Club, 17. And 2 new cases associated with the other positive cases at 480 Lygon Street we identified a couple of days ago. Both those cases at 480 Lygon Street have now moved out. 1 is at 480 Lygon Street, the other is at 510 Lygon Street. We then have 4 cases that are currently under further investigation. 1 is a case in Glenroy. We have some leads that we're following up of possible connections. And we have 2 separate cases in Altona North. Again, we're following a number of leads as their potential acquisition. And finally, we have a teenager from Glen Ira who works at the pizza store in Malvern East that we listed yesterday. That gives us a total of 24 new cases today. There's a lot of work being done over the last few days to try and establish the links. And I think when I spoke a few days ago, I talked about 8 different clusters that we were working through. I'm pleased to confirm we're now seeing a clearer shape emerging of the clusters that we have. So of the 246 cases, 211 are linked and associated with this dominant cluster that started at Hobson's Bay, spread out to Caroline Springs, to Melton, through those large schools that we were dealing with 10 days or so ago, 2 weeks ago, and then into Glenroy. So those cases are all directly connected through a whole series of linkages. That is the largest part of the cluster. Most of those cases are now well understood. All those cases are well understood. Obviously, significant numbers of people in isolation associated with that cluster. I'll expect to continue to see cases coming out as those families and people continue to isolate over the coming days. We have 8 cases associated with one of the original clusters from 2 weeks ago at West Footscray. We talked about it then as I think as a City of Maribyrnong case. It is actually in West Footscray. Those 8 cases across 2 households all quite stable. That hasn't moved. Isolation has gone well. A number of those cases have actually now passed their infectious period. We then have 3 cases associated with the City of Melbourne. That still remains unlinked. We've talked about that, I think, last week. We have 6 cases associated with the 480 Lygon Street tower. I'll come on to that in a moment. And we have a couple of cases associated with a Wyndham connection and a courier worker. Again, those cases haven't moved much. We think we have some probable linkages, but there's 2 there sort of on the outer edge of the radar. That leaves us with 15 cases that are associated in this area around St Kilda, particularly Caulfield North and Middle Park. They're all very, very different, and as Kate explained yesterday, there is no connection bar anything apart from geography. We have within that cluster, we have accountants, we have architects, we have a sex worker, we have members of the Orthodox Jewish community, and we have a pizza guy who works in a pizza shop in Glen Ira. It is a very broad and disparate range of people. The only thing that connects them at this point in time is some association, particularly in that St Kilda area, which is why we're really encouraging anybody who lives, works, or visits and actively uses that St Kilda area, please consider coming forward to get tested. We are exceptionally concerned about what we don't know yet in that area. There are clearly a number of chains of transmission that we do not yet have full pictures of, and we really want to use the next few days to get a full understanding of any possible transmissions that might be happening in that wider area. There is a number of exposure sites listed on our website. There are additional testing facilities we've put in place over recent days. There are some large testing centres that the Minister's gone through, particularly Brighton Golf Club and the racing track circuit at Albert Park, and of course the additional site we've put in place at the Palais Theatre in St Kilda. A number of different options. We really need that broad swathe of the inner south to come forward and get tested. If you've been to those exposure sites, if you're actively using the retail strips around Fitzroy Street and around Balaclava, we want you to come forward and get tested. We have some in-reach testing teams working as well in those areas, picking some of our vulnerable settings, as well as some dedicated testing around some of the retail strips to see whether we can find the source of some of these cases. In addition, we're of course now starting our day 13 testing, particularly for some of those earlier schools. We cleared 500 primary close contacts yesterday. We have around something like 7,000 primary close contacts we will be retesting for day 13 in the next couple of days. Again, my thanks to those thousands of people who are doing the hard yards of isolating. Isolating for 14 days is no easy thing. It's no small ask. My thanks to all those 15,000 people for doing it so well. We've seen, on the whole, a really exceptional level of compliance. Over 1,000 household visits yesterday. Only 3 people referred on for some further investigation and some further action. In terms of testing, we did see a stronger testing day yesterday with just under 40,000 tests. That's over 500,000 tests now in the first 2 weeks of this particular outbreak. We expect to see those numbers continue to rise. I'm expecting to see another strong testing day today, particularly with that call out to the inner south. Can I also call out to the communities in Altona North? Again, 2 more cases identified today. We have a number of different lines of inquiry, but we continue to be interested in that Altona North and Newport area, particularly if you've been active in some of the cafes, if you've been out shopping in Altona North and in Newport. We'd really like you to check those exposure sites and come forward and get tested if there's any association whatsoever. Finally, on vaccinations, over 4.1 million doses of vaccine now delivered in Victoria, just over 2 million of those by our 52 state clinics and the rest by our GPs. And can I thank everybody who is working in those vaccination centres, including our GPs, for the fantastic work they've done. I know it's been a long and hard 6 months to get to this point. We've got a very, very busy few weeks and months ahead of us. We saw a very big week last week, 357,000 vaccine doses delivered last week between the GPs and the state clinics. That's a record week we've had so far. We really need over the coming weeks and months to see those numbers continue to lift as more vaccine starts to become available in the weeks ahead. I'm also pleased to report that for the over 70s in Victoria, 84% have had their first dose of vaccine, and 52%, so over half of our over 70s, are now fully vaccinated, both doses. For those in their 60s, 76% have had their first dose of vaccine, and 45% have completed their vaccination journey. For those in their 50s, like me, 70%, 7 out of 10 of us, have had our first dose of vaccine, and 30% are fully vaccinated. And for those in their 40s, 62% have had their first dose, and 30% are fully vaccinated. So those numbers are starting to become encouraging and good, but there is more to do. We have 25,000 appointments available for first dose Pfizer this week and next week. I'd really like to see people come forward today to start making use of those Pfizer doses. We also have 24,000 first dose AstraZeneca appointments available today. Again, we'd love to see people come forward and get themselves vaccinated. We need to be seeing more and more people coming forward every day, every week, to continue that vaccination and to get us beyond these outbreaks. With that, the Minister, Deputy Commissioner Nugent and myself are happy to take any questions.
Jerome, is one of the hypotheses that the sex worker could in fact be the missing link between these cases in St Kilda?
No, there's no evidence, Julia, for that at all. I mean, this is, again, we're obviously looking at the infectious periods and potential sources of acquisition. I stress there are no known linkages between the 15 individuals that I've called out in that broader St Kilda area at all. So apart from a cluster of cases around the engagement party, 7 in that set, the others are all very disassociated, and we're very keen to understand what those linkages might be. We think there are other cases missing. We think there is an index case we have not yet detected, and that's why we'll continue to work so hard at this as we are.
Some of those cases in the St Kilda, I guess, broader cluster homeless, is that one of the issues you're dealing with?
Yeah, only 2, Rich. I mean, so we've identified 2 people who are homeless and/or transient using a number of different facilities in the area. We are working very closely with a number of those rooming houses and hostels to ensure people are getting tested. Some good results on that last night. As the Minister said, we've not identified any other positive cases in the immediate close contacts of those 2 cases.
I guess on that last year, homeless people were put up in hotels as part of the program. Is that still continuing, and is that something you would look to reactivate if that wasn't continuing?
Yeah, look, we've accommodated a significant number of people over the last 2 weeks, particularly in CQV hotels of various descriptions, either if they're positive cases or if they're primary close contacts, and that's the better place for them to isolate. So we are looking at continuing to offer that kind of social housing support to people in need. We'll stop at nothing to make sure people have the opportunity to isolate safely and to protect themselves and protect the wider community.
Was this woman offered that housing, or did she fall through the cracks?
No. Look, she wasn't. We found her through a presentation at the emergency department. We found another case that was related to her. They've both been very, very accessible, very supportive. They're now both safely and securely accommodated, and they were making use of a rooming house in the St Kilda area.
So they were detected because of an emergency presentation?
I believe so, that's right, yeah.
How much of a danger do you think it is, Jerome, in that St Kilda area, that there are people who might have attended illegal events, illegal gatherings, and they don't want to come forward and out themselves now?
Look, I think it's no different to any other part of an outbreak. I mean, clearly, people are always more concerned about coming forward when they think they might have done something wrong. And I stress again, as we stress so often from this podium, anybody who comes forward for contact tracing, anybody who comes forward and says, I'm concerned, I come forward for a test, if you get into a contact tracing conversation, that information is entirely privileged to that conversation. As I've said before, it's like a conversation with your doctor, it's like a conversation with your priest or whatever other faith you wish to confess to. It is absolutely something which is within the confines of that discussion. It does not go any further. And look, and can I just recognise, we've had some very challenging conversations, particularly in the last 2 weeks. If you think of the places we've been to and where these outbreaks have taken to us, and we've been met by nothing but fantastic support from community leaders and from individuals who've told us, some quite challenging information that we have needed in order to identify the next steps in the chain. And we'll continue to do that in St Kilda and across the whole city.
Is one of those housing crisis centres the one that's run by the Salvation Army on Grey Street that's been shut?
It's certainly, yes. There's a number of locations on Little Grey Street that we're working on at the moment. We're not confining our investigations to just one place. There's a number of linkages between them. We'll continue. We've got some dedicated social in-reach teams working there between ourselves and our colleagues in other bits of government to ensure we support those people.
This time last year, the government was offering accommodation to homeless people regardless of whether they were positive cases or close contacts. Why are we not doing that this time around?
So look, I think Richard, we'll take it on an as-needs basis. If we have reason to believe that there's more widespread transmission happening in this part of the community, of course we'll provide the support and help that we need. And I think if you look at our record over the last few months of supporting people in accommodation, I think it's been pretty good, and we'll continue to do that.
Was there a judgment that the cost of that last year didn't outweigh the benefit? Or?
No, I think it's more around the risk and appropriateness of those measures. So we we are taking an outbreak-led approach that says where do we see evidence of transmission and how do we ensure that people who might be at risk of transmission or who may be positive already, how do we support them to isolate safely? So that's the approach we're taking. Look, I think we are dealing with 24 cases today. We are starting to see clearer pictures emerge about where the risks of transmission are, and we'll continue to work with those communities.
The reality is, though, you're asking homeless people to stay home. They don't have a home.
Sure.
How do they comply with those rules?
Rachel, with the greatest respect, this person who's tested positive has a home. We've tested the rest of the people in her facility, and so far they've all come negative. Our friends at the Department of Family, Fairness and Housing have an extensive campaign that is targeting those at-risk housing communities. Yes, the campaign from last year in the second wave around the hotels and the apartment blocks that were set aside in that time, that's now moved on to an at-risk housing support program that the Department of Family, Fairness and Housing have well and truly underway and are now taking to another level. So I don't think it's fair to equate this particular case. There's a difference between rough sleeping and insecure housing. This person has been well supported in a self-contained set of units. Yes, there's communal areas like there is in any other apartment block in Secura, but they are self-contained, their own facilities. Everyone else in that facility, which is supported by a specialist social housing provider, so far has tested negative. So it's not quite a fair equation to link this person directly into the rough sleeping components of housing. Now, having said that, rough sleeping housing, a rough sleeping community in that Secura area has a blending in and out of insecure housing forms. So it's the one community, but in this particular case, the person has a residence.
I wasn't making any point about this case specifically. I was talking about homeless people more broadly. If you walk around the city today, there are homeless people who don't have homes to go to, who are sitting on the street. What are you guys doing about that?
Through the Department of Family, Fairness and Housing and their at-risk housing program, we're working with social community housing providers. We're working with community housing organisations to support them in many, many ways, both to transition to, I think it's the $5 billion Big Build program that the Minister for Housing is delivering with both social and community housing providers and the private sector, and more immediately through some of the frontline workers, the Salvos, Launch Housing, Co-Health, Melbourne City Mission, a whole range of others, to work with those people to try to get them into secure and protected housing and the support they need for that journey.
Vaccines have been open to rough sleepers for a bit of time. There was a blitz through the state. So do you have an idea as to how many of our homeless population have taken that up?
I have seen those figures, but I can't recall them directly, but let's get them to you. So through a coalition, the C19 coalition it's called, of community health organisations, it's more than 19 of them, there's been a assertive in-reach campaign, there's been pop-up clinics, there's been a whole range of activities that have taken vaccinations to those at-risk communities. And we can get to those precise figures.
Was this woman vaccinated?
I don't have that information, but I'm sure we can get that to you.
Minister, on
Government mandate for public servants to get the vaccination?
So we'll work through those issues. We've already got elements of our workforce where it is, in fact, mandated. Our hotel quarantine workforce, it is a condition of employment. And as per the National Cabinet decision, by I think it's the 17th of September, the state residential aged care workforce will be required to be vaccinated. We've already got very high levels of vaccinations in our frontline healthcare workers, but we'll work through those processes of making sure that all of our workforce is at the highest level of vaccination that we can possibly get them. At the moment, our biggest issue is how do we transition from what has been a period of relative scarcity of vaccine in the coming weeks, if not month, as we see Moderna start to come online with our pharmacies, increasing levels of Pfizer coming in, whether it be from Poland, whether it be from the September allocations being brought forward, and the increased numbers that we will see of Pfizer in September. We think there will be increasing supplies, and we are confident that particularly our own workforce will see the benefits of being vaccinated, seeing the benefits of getting to the other side of this, but we don't rule out taking any measures that are needed to get us to that 80 and above % figure.
Do we know when those doses from Poland are due to arrive in Victoria and who they will go to?
As I understand it, they will start to arrive over the weekend. My understanding is of the 1 million, Victoria has been allocated 175,000, and we're just working through the processes now of where the most direct impact for those vaccines will be.
Do you expect to make appointments available next week linked to
I beg
that?
pardon?
Do you expect to make appointments available linked to the Polish delivery next week?
I would certainly hope so, or whether it's targeting to areas such as our distribution centre workforce, which is a critical infrastructure workforce. We've seen similar programs to secure that in the troubled areas of South and Southwest Sydney. We're working through some of those programs with our major distribution centre providers, and equally we would think that in the areas of highest risk geographically, that we'll target these Pfizer allocations as they come into the system into those areas.
Year 12s, Minister? Could Year 12s be part of that cohort?
I can't say at the moment. We know that with increasing allocations coming in over the next couple of months, that we want to make sure that we get jabs into the arms of everyone that's eligible, and we're working through what that looks like for many priority groups.
I believe the Premier has
Qantas is mandating the jab. Wouldn't it send a strong message from government as a show of support if they also mandated the jab for some workers, such as frontline staff?
Well, as I've indicated, we've already got a very strong mandate in place. Our hotel quarantine workforce has had a mandate in place for most of this year, and we're in the process of delivering the residential aged care workforce that is our public residential aged care force. We're hopeful that the Commonwealth will meet its target of the majority of that private residential aged care workforce by the date, and we look forward to working with the Commonwealth to make sure that they deliver on their commitment, that they will manage that area, because that is really important to the safety of vulnerable aged Victorians. In regards to the wider message, like I said, our major problem to date has been supply. That is about to flip. We are going to see increased levels of supply, and we want to make sure that whether you're a public servant, whether you're a private sector worker, that you come forward and get your jab to get us to the other side of this. In regards to Qantas and those areas that really need that demonstrable evidence of vaccines to essentially operate, then we say that's a matter for them. The regulatory framework for that is a matter for the Commonwealth, but we are very strong supporters of encouraging through either legislative, occupational or other forms of incentives, getting people vaccinated.
Minister, would those extra doses will go to a specific workforce, or will you be opening it up for young people?
Well, we're working through those issues once we get clarity from the Commonwealth, which I'm not complaining about. Lieutenant General Fruin's horizons have been pretty spot on. And as we get the certainty of what specifically is coming forward from the 175 and the 147,000 that was brought forward from September, just what is precisely appearing when, together with what we know the pharmacists start getting next week and that others start getting through the primary healthcare system, we think we're going to transition from having a scarcity of vaccines to now really moving into a period of time where we want everyone who is eligible to come forward and get vaccinated as soon as possible. And we'll be targeting messages to those local communities where those gaps in our state clinics are available to really micro land those messages.
When can we expect an announcement on where those doses? When can we expect an announcement on where those doses will go?
As soon as possible, and when we've got more to say, I'm sure we will very quickly share that through forums such as this, because what we want is we want those vaccines when they come to Victoria to get out into our state-run clinics, out into our GPs, to our community health organisations, to our pharmacists, and into the arms of Victorians.
Minister, a lot of mental health staff say they're facing burnout just because of the accumulation of the last couple of years. Would you support encouraging people to be brought in from overseas to fill some of those spots and prioritise?
So we know that our wider medical workforce, not just our mental health professionals, have for many, many years relied on overseas workforce to keep up their workforce numbers. And we thank many of those who are members of the international community who are still here. Over the last 18 months, that tap has largely turned off, and that is a contributing factor to not just our mental health workforce challenges, but our wider medical workforce challenges. We're working with, whether it be mental health specialist providers, surgical providers, nursing providers and others as to how do we manage within the fairly strict caps that we strongly support, how can we continue to bring in particularly those specialist groups through our quarantine system, whilst at the same time managing the demands of tens of thousands of Australians who still want to come home.
Can we please change the subject and have Jerome back for a moment?
Sure you can.
Sorry, Jerome, and thank you. Just a couple of questions on playgrounds, but before I do, have I correctly understood the sex worker is a mystery case? We don't know how she got it.
Correct, that's right. So as I said, in that St Kilda sort of broader area, we have 15 different cases. At this point in time, we don't have source acquisition for any of those 15 cases, but they are clearly operating in an area where there's a lot of overlaps, and that's what we're keen to get to the bottom of.
On playgrounds yesterday, Brett Sutton said they are investigating a potential case of transmission at a playground. Any update on that?
Well, not specifically. So we've got, as we've seen in this particular cluster, we have 22 households associated with one school where we've seen transmission between children. There's a large number of children involved. There are, 111 children under the age of 18 and under involved in this particular outbreak. So we have a large number of children focusing on this particular outbreak. 22 households with Altaqua, 11 households, I think, involved with Mount Alexander. All examples of where children have transmitted, both within their households or between themselves, both at school and in other settings. We certainly have examples of at least two sets of children where we've seen transmission outdoors between children making other kind of movements. Those investigations continue. And we have 2 playgrounds currently listed as exposure sites.
Sorry, Drone. How many children are symptomatic?
I don't have that number in front of me. So, I mean, we know, but with over 100 kids currently involved in these outbreaks, there are children who are in the first wave of this particular outbreak, particularly around the larger schools, particularly grade 2, grade 3 and grade 4 students, particularly at Altaqua, at Glenroy and at Mount Alexander, all having interactions both within school, on the way to school, in social settings and at home. That's where we've seen the transmission take place.
In the last couple of days, there was a child in hospital.
Yep.
Is that child still in hospital?
No, so we have 2 people in ICU. There are no children in hospital, full stop. We have people in their 20s, 30s, 40s, 50s and 60s in hospital. In ICU, we've got 1 individual in their 20s and 1 in their 40s.
There's a large apartment block on Fitzroy Street in St Kilda, 181. It's still a Tier 1 site, even though there are no positive residents there. I understand it was a cleaner who visited. Residents there say they're frustrated about the fact it's still Tier 1. Can you give them any clarity about whether that might change?
Yeah, look, I mean, 181, that particular apartment block is a particular concern. Fitzroy Street is at the centre of a number of these different cases that we have in that St Kilda area. So We have evidence of a positive case cleaning in the common areas of that building. We're pleased that we've not found any positive cases in the building yet. But as we've seen with so many of our apartment blocks, we do sometimes see onward transmission over the coming days. At this point in time, until we get clarity on what the index cases are for that wider St Kilda event, we will be keeping it up as a tier 1.
Have there been any onward transmission linked to the sex worker, or is she just a case on her own at the moment?
No, she's a case. There's two individuals who are known to each other. We're investigating what the direction of the flow was between those two individuals, but there's no onward cases at this point in time. As the Minister said, we've tested a number of the primary close contacts. We're about, I think, 3/4 of the way through the rooming house where she was living. All those tests are so far negative, but we expect more results today.
So were they the two cases yesterday where you had a City of Melbourne person and a St Kilda person who were socially linked?
That's right.
Yep.
Yeah.
Given that
Rich, I'll come to you.
presented at a hospital emergency department, you
Yeah.
said, does that mean there's been some staff furloughed from that hospital?
No, and I think there was some commentary yesterday in the media. Look, this is why our ED rooms, particularly in this kind of COVID active state that we're all under at the moment, we know there is community transmission across Melbourne, and we know we can see a lot of it. There's still some pieces we don't have. Our EDs have got outstanding procedures in place to manage the safety of people coming into ED, but of course themselves as well.
But have they been alerted or just put on standby?
They've been put on alert. So we've lifted the alert status 2 weeks ago for given this cluster was going on, given the restrictions we put in place. All of our hospitals in metro area are already at a high level of alertness at the moment.
Do we know if these St Kilda cases are genomically linked yet?
All the cases we've seen so far are all genomically linked. Obviously, as we get new cases, we test them all genomically. It always takes 24, 36 hours to get those results, but every case we have so far is all genomically linked. It's all genomically linked to the Southwest Sydney cluster. I think, as Brett explained a couple of days ago, the Southwest, there's not much variation currently between both the Southwest Sydney cases and what we're seeing here in Melbourne. So it doesn't give us a complete direction on which bit of the cluster it's associated with, but they're all part of the same can of worms.
Just on the Newport Hobsons Bay cluster, we had a case yesterday that had exposure sites at a tyre business dating back to the 2nd of August.
Yep.
Are we still considering the Altaqua teacher as the first case?
We are. So at this point in time, the teacher in Hobsons Bay and her partner, the optician in Caroline Springs, are still the two earliest cases that we've got. We're still looking upstream. We're still keen to find that source link. It is not impossible. Again, goes to the earlier question around genomics. That particularly with that St Kilda, the St Kilda cluster, if I can call it that, the St Kilda gathering, that there's been a separate incursion event. That is entirely possible. Obviously, that's why we're looking for any clues that we can get.
Are you still ruling out a link between that engagement party and the other St Kilda cases?
We're not ruling anything out, but I think at this point in time, I've got no more evidence to link the engagement party to any other parts of the cluster in St Kilda or anywhere else.
How many people have tested positive from that engagement party now?
7.
All of them tested, all 69?
All 69 tested, yep.
And just so to clarify, do I understand that of those entire 111 students, those people under the age of 18 who have tested positive, that you believe only 2 of them have transmitted or caught the virus outdoors?
No, that's not what I said. I think I've got 2 examples of at least 2 examples of children in that 111 cohort who transmitted in an outdoor environment, either walking to school or playing outside. That's the evidence we have at the moment.
So is there any more than 2? Do you know the number?
There are 2 sets at the moment.
So 2?
4.
Oh, 2 sets, so 4?
Yeah, that's right, yeah.
Okay.
And just back to
What were the
Newport
details of
case,
those transmissions? What were the details of those transmissions?
So one case is between a child who's at Glenroy Primary School and another child who was at Corpus Christi. They had some kind of social encounter outside, and that's where we believe transmission happened between that cohort. We've not seen any other transmission to the Corpus Christi environment. There's a couple of other cases where we have evidence of children playing outdoors that we're still running to ground, but certainly two examples that I can think of.
Sorry. Just back on the Newport case, why does it date back to the 2nd of August? That's a very long time ago now, that exposure site that was only listed yesterday. And are you certain that that case got it from other people in the Newport cluster who we know about, or are they not linked directly?
So let's go back. I mean, we've got events of transmission happening in the back end of July for this particular outbreak. Remember, if we go back to the infamous footy match, that was the 29th of July. So we've got quite early. We've got early onset events going way back before the 2nd of August. I agree. The case that came out recently that was connected to the Tyre Power Plus site. We went again, as we always do, very precautious about possible early infectious period, also to try and establish if there's any other upstream connections that we can find.
Last question.
Minister, can I ask you quickly? On kind of linked to playgrounds again, we heard about some of the logic behind behind shutting them yesterday, risk of outdoor transmission, shutting playgrounds. One would think the same logic would apply to childcare, kids running around. What's the logic behind shutting playgrounds but keeping childcare open when it shut during the second lockdown last year?
Well, childcare is a controlled environment. They have quite strict protocols in place that are both federally and at a state level supported. And I think there's always a difference between a regulated, controlled environment and an unregulated environment. We've seen with Delta that Delta has changed so much of what we understood to be, if you like, the accepted epidemiological and transmission environment from 2020. We've seen in 2021 the Delta variant move quicker. We've seen it move in outdoor settings. We saw the MCG, we saw Amy Stadium, and we've seen fleeting transmission in a range of areas. We're seeing it apparently every day in increasing record numbers in New South Wales. So I think a combination of Delta, a combination of the fact that the virus is finding its way increasingly into unvaccinated groups, which is school environments, which is children, and as you've said, 110 plus people under the age of 19 currently have the Delta variant. Some of those cases have been proven in having acquired and transmitted in outdoor environments. We've got a skate park as a Tier 2 exposure site. We have to work on the basis of the public health advice and the evidence and manage that against the controlled environments of childcare. So I think they're qualitatively different.
But by the same token, childcare is largely indoors, an indoor facility. Playgrounds are outside, which is generally less risky. Did you give any thought to keeping playgrounds open and perhaps having a QR check-in for parents?
I'm sure the public health team go through all of those factors when they consider their public health orders. But in regards to playgrounds, I think the evidence is that we've got 110 young people already infectious. Young people and kids in particular hang out in playgrounds. It's a risky transmission site. We've seen outdoor transmission, and no one wants to close playgrounds. No one wants to have a lockdown. No one wants to have schools closed. What we want to be is on the other side of this as quickly as we possibly can, and that means having to go hard and to go for as long as we need to go hard to keep this down and reduce the numbers, or we will be in the Sydney territory of rapidly escalating numbers. My understanding is it's past 600 cases today, and what we've seen is that in 2 weeks' time, that will mean more people at record levels in ICU, more people in record levels at hospital, and more people dying. Those are not the options that Victorians want to face, and our public health team have made the tough decisions to make sure that we avoid that scenario. We've already seen this outbreak, at least on a number of proven occasions, result from Sydney incursions. We want to make sure that we drive those down.
Just in terms of getting to the other side of this, your own data shows that we're still seeing, for all the cases, say for example, on day 9 of lockdown, they were out in the community for a collective 47 days of exposure, compared to the previous lockdown by that time had it down to 8. So are these rules even working at this point, or are we in this for a lot longer than another 2 weeks?
Well, it's too early to say. Clearly, unlike the May-June lockdown, where the results of having cases, still having cases, but them all being linked and they're all being isolation, drove down those numbers. We're starting to see increasing numbers being in isolation again, but we're not where we want to be. I would imagine, given that we've got some forget exactly, but could be north of 10,000 primary close contacts being up for day 13 testing over the coming days from the original parts of this outbreak, that we would expect to see an increased number of cases. But because we know who they are, because we know that they've been in isolation, that gives our public health team the confidence in those cases. It's the cases that Jerome talked about, a relatively small number, but we need to drive those down, the unlinked mystery cases. The vast bulk of this cluster at the moment is locked down and understood. But if we don't take all the necessary measures to drive these unlinked mystery cases down, identify them, link them, then in the not too distant future, we would be in Sydney's position, which is why we're calling out today's cases, particularly in that St Kilda, East St Kilda, Caulfield geographic region, and more broadly, launching our Only a Test Can Tell campaign.
As a former mental health minister, how concerned are you about the increased presentations to emergency departments and people presenting to their GP for the first time throughout this pandemic? How concerned are you?
Very concerned. I think every Victorian is concerned that we are seeing increased pressure and strain on our mental health system, be it our primary care mental health system, our community care support, or our acute hospital mental health system. Running into the global pandemic, that was a system that we acknowledged had been underfunded and essentially broken for generations. That is why we launched Australia's first Royal Commission into our state mental health system and its links with other forms of Commonwealth and other care. That is why we have accepted every one of the recommendations, have over $3 billion worth of investment in that delivery, and as recently as this weekend just gone, announced over $7 million for a youth prevention and recovery centre in the northwest, targeting those high-risk communities for the acutely unwell young people. And we know that the acute system is under stress, the community system is under stress, the primary care system in mental health is under stress. And that's why this is a government that is determined to do more than something. It is putting in place the workforce, the supports and the investment to make sure that we deal with that.
Do you need to fast-track the response to the Royal Commission in light of the pandemic and the extra stresses that are being put on the system?
Do I think?
Do you need to fast-track the response to the Royal Commission given the situation we're in now?
Well, I would say that we are fast-tracking that, but there is always more to do. What we have seen is a system that was under stress and already broken further have to look at how it delivers support in the context of what some have called the shadow pandemic of mental illness crisis, whether that's presentation at GPs and primary health care or whether it's crisis presentation at acute mental health facilities. Right across the board we've seen an increase in that, and that is why this government is committed to working with everyone in that sector, including the Commonwealth Government, to do not just something about it, but to refashion and reimagine that system, but in doing so, take people with mental illness on that journey in the heart of design, in the heart of workforce changes, and make sure that we have a better, different system coming out of this pandemic.
Minister, on the Police Association's comments today, are we at the risk of losing their rank and file member support for things like the curfew and playgrounds?
I haven't seen the Police Association's comments. I refer you to what the Chief Commissioner had to say yesterday.
Could we just have the Deputy Wayne Gack has said that the playground ban is not what police signed up for. Have you given any thought to the fact that it could create a divide between police and the community at a time of serious lockdown and COVID fatigue?
I'd refer you to the Chief Commissioner's comments yesterday, and I'm sure Deputy Commissioner would be more than happy to answer that. This police operational matters. Police, we're in a global pandemic, a 1 in 100-year event that has seen the public health crisis associated with the pandemic at the heart of a response. Victoria Police over the past 18 months have stepped up to do things on border controls, on hotel quarantine, on compliance for thousands of people in home isolation, of policing public health orders in ways that I'm pretty sure 2 years ago no one would have thought would be a part of policing. Because we are in a public health crisis, our frontline Victoria Police members have, probably more than most, done so much to keep us safe, and I want to thank them for that, and I want to thank the leadership of Victoria Police for bringing the rank and file of all those thousands of hard-working Victorian police officers on that journey. They have been critical in keeping us safe. I might ask the Deputy Commissioner perhaps to address those issues.
I was going to say, Rick, we just heard everything that police are being expected to do over and above your normal duties. Are we to believe that you are policing playgrounds?
We're not. Our members haven't been tasked to police playgrounds at all. I can tell you that. What we are tasking our police to do is to ensure that the community complies with the directions that are put in place to prevent the spread of the virus. So it's really important for our members to be out there, being visible in the community, being active in the community, engaging with the community to ensure that they do comply with those directions. What we saw over last weekend and a little bit the weekend prior was blatant and deliberate breaches of the directions where people chose to congregate in large numbers, drinking alcohol, having picnics and engaging behaviour that's really not helpful to all of us. So in terms of our approach, we've said to our members, be understanding, work with the community, but where there is a blatant breach, a deliberate breach, where someone chooses to totally disregard the directions, they'll be issued with a fine.
So Deputy Commissioner, would your members hesitate to dish out a fine at a playground if somebody was there with their kids letting them play on it?
I think it's, well, what I've noticed firstly is that the playgrounds have been closed. They've been taped up and closed for the most part that we've seen. I think it would be highly unlikely that our members would issue a fine at a playground. There's two parts to that. Firstly, we have a different approach to children than we do to adults. It's a $5,452 fine for breaching the gathering. That's contained within the CHO directions. We're not going to give a child a fine for that amount. If we see deliberate and blatant breaches by a group of youths, for example, we will engage with the youths and work out what's the best approach with them. Is that a warning? Is that a child caution notice? Whatever that might be.
Have you got any stats on the infringements that you've issued over the last 24 hours or the last week?
Yeah, so the last 24 hours we issued 47 fines. We have 4 major operations running at the moment. We have the New South Wales border arrangements in place, critical that we prevent someone from New South Wales, the red zones coming into Victoria and spreading the virus. So there were 4 fines issued at the border. 3 of those were to truck drivers, 1 who hadn't had a COVID test and 3 who didn't have the right permit. Also a bicycle that tried to outrun the police in a car, doesn't generally work. So there was a fine issued there for not having a permit. There were another 42 fines in Greater Melbourne area, and they're a combination of no masks. There were 5 for breaching curfews, and there was a whole range of other fines for breaching CHO directions, so more than 5 kilometres not permitted, purpose and so on.
Regional businesses are reporting having to turn hundreds of people from Melbourne away over the last couple of weeks. Why not introduce a ring of steel and take that responsibility off individual pub owners or shop owners and put it back on law enforcement?
It's a combination. So we absolutely support that the local businesses in being very active to ensure that people from Melbourne aren't there. We currently have 200 police patrolling the border of Greater Melbourne and regional Victoria. So there's 200 police a day tasked to that. We are using ANPR technology to identify those vehicles that are registered within Melbourne, and they're being actively checked. There was 1 fine overnight for breaching the Greater Melbourne area and moving into regional Victoria. At the same time, we have our police divisional vans and patrol cars in all of those regional areas, more particularly the tourist type areas, your Dalesford, your Trentham, your Mornington Peninsula, your Dandenongs, your Yarra Valley. So they're very active in checking in those regional centres as well, getting out on foot, engaging with people and checking that they're appropriately in those cafes and restaurants.
How many people are actually getting picked up on kind of the periphery of Melbourne? Because if businesses, individual businesses, are saying hundreds themselves, that sounds like it outweighs the number of people you're actually picking up.
Yeah, well, it's one of those areas that we're really quite focused on to ensure that we do prevent people moving into those areas. We are active in the towns, as I was saying, we're active on the border, and the people that are found to be breaching are issued with the fines.
Is it fair, do you think, to put the responsibility on individual business owners to be checking those things themselves?
I think it's fair that we all have a responsibility during this pandemic to do what we can to prevent the risk of the spread of the virus. I think we've all got to be active to ensure we're doing the right thing and supporting all of the agencies, supporting health workers, supporting COVID contact tracing teams, supporting the police. So it's, as the Minister said, it's a once in 100-year pandemic. We're all doing things a bit differently.
During the second wave, we didn't have police having to police our border because New South Wales was doing it. We also didn't have police having to be involved in hotel quarantine. How many fewer police are you able to devote to COVID compliance this year than you were this time last year?
We're about the same at the moment because shielding, which is the operation targeting mass gatherings, involves PSOs and police, a combination of PSOs and police. So at the moment, we have around 350 police at the New South Wales border. We have 200 police doing the metro regional border. We have another 100 in regional Victoria, part of Operation Sentinel that we've had running for a long period of time. And as well as that, we have police in the hotel quarantine program. So and we've got the PSOs with police is around 200. So it's the most amount of police dedicated to COVID operations we've had since the pandemic began.
Have we seen any more illegal gatherings?
We're still seeing some. So some of the fines overnight were for private gatherings. For the most part, they're Airbnb type parties or short-term rental parties, I should say. There's some of those gatherings of 8 or 9 people and fines have been issued. We've had a report, or reports rather, of public gatherings, but for the most part, when we've got there, they're not there. It seems that certainly since Monday, community compliance has significantly increased.
Have you got reports, like how many people are reporting these breaches? Are people keen to make sure that people are caught for doing the wrong thing, sorry?
Yeah, so certainly Saturday, Sunday, we saw a significant number of reports phoned through to the police advice line. It was around 800 on Saturday, or in excess of 800, in excess of 900 on Sunday. Yesterday was around 500. Some of those are past breaches. Some of those are advising where they believe a business might be operating when it should be, or a gym might be operating. We get there and find they're not. So the ones that are occurring at the time are put through to D24, who are then allocated to a Sentinel unit or to a local police vehicle to go and check.
Is sex work legal at the moment under the current restrictions?
Well, depending where the sex work occurs, so licensed brothels, for example, is legal. Sex work on the street is, as it stands now, currently illegal, and so is soliciting for prostitution.
So this new case, if we find out that she has worked, would she be fined?
Well, I think it was touched on by Jerome before about the importance of the contact tracing and identifying where a person has been and what they've done and who they've engaged with. We would engage with the health team and Jerome on that, as we regularly do around investigations. I don't see it would be something that we would issue a fine in that circumstance. So it wouldn't
be considered a blatant breach like what the Premier was referring to on Monday?
Well, it would depend on the circumstances. We've got to treat everything, on its own to understand what's occurred, how it's occurred, and whether or not a fine would be warranted in the circumstances. I think if a person has come forward to the health team to explain everything they've done, I think we do need to tread carefully around that.
Do you believe rank and file members are supportive of these extra responsibilities, such as policing the curfew and being out and about in the parks?
Our police, can I say from the outset, are doing an amazing job. We have so many police deployed to the borders, a long time away from home. We have them in a quarantine program, doing roles 2 years ago we would never thought we would be doing. But it is so important. We play a critical role to ensure that we have overall compliance within the community. you want to wrest your way out of a pandemic, ultimately, but it's one really important component to ensure compliance. And the community would expect us to. The community would expect us to respond to mass gatherings where people are all drinking and disregarding the CHO directions. At the same time, our police might not want to. I wouldn't really want to issue a fine, but I would if I needed to. So by and large, our people are doing a fantastic job. They assess the situation well, they determine whether or not it's a blatant breach, and they issue the fine.
Just one really quick one for Jerome, if that's okay. The Glen Ira and Port Phillip councils are calling for everyone in those areas, even if they don't have symptoms, to get tested. Is that your message as well, or do you just want people with symptoms?
No, a great opportunity. Thank you, Rachel. Look, absolutely. So anybody who is living in St Kilda, who works in St Kilda, who visits St Kilda, you've seen the exposure sites on, we really want you to come forward and get tested. We need to use, the lockdown restrictions we're all living under are wearing heavy on all of us. None of us wants to be here. None of us wants to have the kids at home and to live the way we do. We have to use this time to work out everything we need to find. We need to get those chains of transmission. We need people to come forward and get tested, particularly in those areas, particularly in that St Kilda square between Caulfield and Middle Park. We want to know as much as we can. So, yeah, come forward, get tested.
And just on a related note, there was a caller at ABC Radio this morning who said that he and other people had been turned away from a testing centre in that area because they had symptoms and that testing centre was only doing asymptomatic testing. Is that ideal if that's what's happening?
Yeah, I didn't hear the report this morning, but I think, look, we have a couple of testing stations set up which are very bespoke within that area, dealing with particularly vulnerable settings, so they're not available to the general community. One of those testing sites in Caulfield is an experimental test and vaccination centre, so we are not taking people who are symptomatic, but they are being referred to alternative testing locations in the area.
Can I just ask on that? Sorry, just wanted to confirm 2 cases in ICU.
Yeah.
Do you know what our ICU capacity is for COVID patients?
We have we have a significant capacity and ramping up of capacity within all of our health services. So we track the number of, we have a number of designated COVID wards across a number of our major health services across Melbourne, also in regional Victoria, should we need to use them. There is sufficient capacity available both on the general COVID wards and in ICU to deal with any of those patients. And of course, we're working with our health services to get them ready should we need more capacity in the future.
And Minister, I'm sorry, I've just had a question come through from Year 12s, and I don't want to keep us here, but it's been a really tough year for Year 12s. The ATAR and the first round offers have been moved back for Victorian Year 12 students. Is that because of the pandemic?
I think the Education Department put out an announcement last week about the delay for the general assessment test, and in regards to further announcements, I'm not briefed on those, but I would have imagined that the Education Department, together with the independent school sector and the Catholic school sector, is putting in place the arrangements they need to make sure that our kids get through what, in the best of times, is a tough year. So I'm sure we can get you the answer to that.
Can we expect a press conference from James Molino sometime soon? Like, anecdotally, we're getting a lot of questions from Year 12 students and parents wondering what's happening.
I know that Victorian Government, right across the board, right across every portfolio, is working very hard on the impacts of the pandemic on particular portfolios, and I'm sure that whether it's education, mental health, regional development, economic development, all of those issues are under pressure as a result of this pandemic, and when the government's got more to say and in response to particular issues, I'm sure we will. That should not stop any of our hard-working media friends from putting questions to us, to those portfolios, should you so wish.
And business support tomorrow, are we getting an announcement then on that?
I beg your pardon?
Business support?
I'm aware that there's discussions going on again with the Commonwealth, recalling, of course, that the current arrangements for business support are in place until at least tomorrow, and I'm sure the relevant ministers at both the state and Commonwealth level are working through those issues.
All right, thank you. Just one more question. 633 cases in New South Wales today. What's your reaction to that, and have you given any more thought to keeping our border closed to New South Wales even past 80% vaccination?
Well, on the last question, we're committed to the national program that was signed up by all jurisdictions, including New South Wales. New South Wales and every other jurisdiction will open up when cases are at the low levels or zero levels that the Doherty model is based on. And I'm pretty sure I heard the New South Wales Premier recommit to that at one of her recent media conferences that I saw a snippet of. And in regards to the first issue, which was...
What's your reaction to that? Your reaction to that, many cases of record cases there, and the risk for Victoria?
It's a concern. The risks to all of Australia, and now I see New Zealand, from leakages from the New South Wales wave is a significant concern to all of Australia. It's a concern to Queensland, the ACT, who's now been caught up in it. Victoria is battling hard to get these numbers down. Other states have taken measures. New Zealand has now had to take measures. We want New South Wales to be successful. We need New South Wales to drive those numbers down, and none of us can rest easy until such time as Australia as a nation responds to these arrangements, which is why the national phased program is so critical, which is why these tough measures that we're having to take now to get us down to either zero or manageable levels is so critical, which is why Only a Test Can Tell campaign that we're launching today is so important, and which even more importantly, the long term, in fact, not that long term, the very soon to be upon us campaign of making sure that everyone gets vaccinated is so critical.
As we approach September 2, will we expect to see like a roadmap out of lockdown similar to what we did last year coming out of stage 4?
Well, I think the roadmap is there now. It's called the National Plan. It's the Doherty model work that every state and jurisdiction has signed up to. That when we get to 70%, a whole heap of things become available to us. And then when we get to 80%, a whole heap of other measures become available to us, and we start to rule out some of the tougher measures that we're all having to endure now. The roadmap is endorsed by National Cabinet. The roadmap is the Doherty modelling.
But Minister Jerome said only 50% of our over 70s are currently fully vaccinated, and they've had access to the vaccine for the absolute longest time of anyone. So how long will we realistically have to wait to get to 70%?
Well, that's a issue that all of us can choose to deal with right now. Those people that Jerome indicated, I think about half of the numbers of people are over 40 that are in hospital at the moment. I'm not sure how many have been unvaccinated, but I'm going to make a bet that it's the vast majority. Those people have all had an opportunity to be vaccinated.
I'm just saying these are the highest risk people and they still haven't been fully vaccinated.
So let us use this as an opportunity to once again reinforce to any Victorian who is eligible, come forward to a state clinic, come forward to a GP, get yourself vaccinated. You will avoid exponentially the prospect of being hospitalised and being sick and potentially dying, as we're seeing in New South Wales. But even more importantly, you will keep your family, your community safe, and you'll be part of getting us to that Doherty modelling of getting us out of this global pandemic and into a better open world that we all want to see. There's a million reasons why you need to get vaccinated. You are one of them. Come forward and get vaccinated if you are eligible. All good? Thanks, everyone.
Thank you.